Welcome to Mastering and Guideline in Ultrasound and Echo. In a patient with MR, we got this image. For doing Doppler on the MR and using the result for calculation and all those stuff, what we have to do, just we have this view, what should we do? That is right, we just put continuous and we'll be fine, measure VTI and everything. No, we have to move probe medial of the patient and doing a little towing. Third, no, we move the probe to the lateral and doing healing, or we just move a little one intercostal higher and we scan and then do continuous. Here we have a patient with previous moderate to severe MR. The type of the MR was concentric. For follow-up, come to your department and you do echo study. In both study, previous and now, you measure Vena Contracta 6 millimeter. in this time, LA and LV size a little increased, but not too much significant. Blood pressure in previous study was 145/90. In this study was 125/85. Previous global longitudinal strain average was -20%. This time -18%. EF in both study almost the same, around 60. If we assume that both study technical was correct and perfect, what is going on and what is happening with the MR of the patient and clinical situation? First, it seems everything is the same, especially those important parameters. The other changes is not significant, so we do just follow up 3 months or 6 months. B, it seems the MR getting worse, even the result is almost the same for grading MR, but we need some more accurate technique like that, spectral Doppler, 3D, or so on. C, it is the starting of the compensation stage. And D, it is better we do 3D for more accurate evaluation of MR. We have a patient with MR. We get it PISA at mitral valve level, as you can see. Okay, based on this, which of the following statement will be correct on this case? PISA and Vena Contracta, both of them, will be reliable for grading MR. B, spectral Doppler or 3D will be more accurate on this case. C, all those techniques will underestimate MR in such case. And D, patient has, based on the image clip, has severe MR. Now let's go to the next one. Here we have another one. There is a patient without AI, aortic insufficiency, and without intracardiac shunt. With this assumption, we do echo and we got all these parameters. Mitral valve inflow 80 milliliter, left ventricular and diastolic volume 150 milliliter, LVOT stroke volume 60 milliliter. Based on these findings, answer to these questions. How much is EF? B, how much is the left ventricular and systolic volume? C, what is the most probably diagnosis on this patient, if there is, based on those findings? And D, what is the severity of abnormality in this patient, if there is any? Please, if you haven't write all those answer of all those questions, stop it here, pause it, and don't go to watch answer. The reason I brought this category of the lectures, multiple choice question and case study, is not just give you information, it's one part. The main and most important reason I brought this, that it help you brainstorming, refresh all your knowledge, bring it up, and establish your long-term memory. That is the best technique. Using those knowledge, information related to the case and situation, then it stuck forever. Okay, if you haven't done, pause it, go back, answer to all of them, and then come watch the answers. Now let's do it. Now let's see the answers.